Hi, everyone, and welcome to a simplified review of the Reveal My DNA test. We're going to go through the test today quickly and hopefully show you a way. If at first glance, this will be the time for you to review this test and share the results with your patient. We're going to show you also how to quickly share these results once you get a quick overview of it yourself. So the test always opens up to the start, which is nutrition, metabolism, and digestion. This is actually a real case, so we're going to take a look at it as if it were you or your patient. This person has the APOE status. This is always where we start. APO status E4, E4. So the APO status is most important because it gives us an indication for risk for cognitive health and Alzheimer's. Now, as we always tell you, with this test, this is not a destiny, but a roadmap. Your DNA is not your destiny, but a roadmap to your future and present. So what we can do is use the actionable items on the boxes on the right, which are taken from clinical trials with people with these specific genotypes and having positive outcomes. With these outcomes, we can help change the present and the future of your existing patients and future patients, hopefully. So we start here really quick, and what we're going to see is the APOE status. It's E4. If it's E4 in either side, E4 from either parent, heterozygous or homozygous, we come right over to this box because this box will be loaded with information for this patient. This is very important to communicate to the patient and let them know things they can do once they have an APOE4 status. Now, again, this does not mean they're going to get Alzheimer's. It means the risk factor is increased. So what happens, and you can look at this right here, although inheriting a single or double APOE4 genotype does not mean a person will develop the disease, it just increases their risk. So the test then provides multiple options for this patient to engage with to lower that risk factor. You'll see nutrition here. You'll see different vitamins. You will see medicinal mushrooms. You will see different foods, fats, protein options, and exercise. So this, you might spend a couple more minutes here, but then you get to move quite quickly through the rest of the test. So we always stop at APOE status. Now, if it's a 3 or a 2, this box is much shorter, much smaller, and there's a lot less information there. It's when there's a single or double E4 that we take action. Next, we move into the macronutrient requirements. We're talking about metabolism. We're talking about protein, carbohydrates, and fats. So we're looking for anything out of the normal range, anything that says high or very low or high risk. And then we take note and we will read the box on the right and see if there's any information we want to pass on to the patient that is pertinent. So here we have average, nothing important to pass on, but all of a sudden we've got high. So here we're going to take note and take a look at this box. This information we do want to pass on to our patient. And what we know based on their genotype is that they are associated with a higher emphasis on monounsaturated and polyunsaturated fats. And here are the sources. So you're going to share that with them and let them know those are foods and oils they want to consume. Also here, very low. This is equally important as high. Very low saturated fat from red meat. That means this person should aim to get less saturated fat in their diet for meat in terms of their metabolism. They're going to metabolize it slower. So what we need to do is ask them to limit their red meat consumption once a week. If they choose to eat a little bit more red meat, we're going to ask them to eat a leaner cut. Continuing down, we follow the same patterns with the saturated fat. And the next box we see is celiac disease. This will give you a little bit of information of a genetic risk towards celiac. If it's a high priority and they're presenting with celiac symptoms or gluten issues, you might want to go ahead and get them tested for celiac disease. But that really only comes in high priority or they're presenting to you with stomach and gastric distress. Next is your vitamins. So this is an easy way to be sure about how to lead them into good food and nutrition. Look at anything that's high, as you see here, high B2 riboflavin. So You don't really have to read this box out to them what riboflavin is or the information, and know that this food here will be down below in their food grocery list. So we're going to keep moving. So just as a practitioner, as you're going over the report, just note and or highlight anything that says hi. So you can always come back and review, figure out which vitamins and or foods this person should be consuming to maximize their health. And you'll see why on the right. So here you see choline and betaine. We highlight it. And why is it important? Well, the more betaine they consume, the less choline they require. Choline is crucial for pregnancy, it lowers anxiety, so on and so forth. And so you need note of that. And then you can look into the foods here. But again, you're just jotting down and highlighting choline and betaine. Continue to move down the list with anything that's high. Vitamin A I didn't mark it because you get the picture. Same thing with selenium. Just want to keep it moving for you. All right. Next, we get into our phytonutrient requirements. These are plant-based nutrients that mostly should be coming from diet, but can also be supplemented. So anything increased or high, you can take note of. I feel that importantly, high is the most important thing to worry about. Increased if it is related to and or impactful in their current health situation. So if you know that they are having issues with gut health, for example, you will start to take note because it's increased need. Also eyes. So again, increased, all right, they've increased need for lutein zeaxanthin. We don't do much about it, but if it's increased and they do have eye health issues, then you definitely take note and can speak to them a few moments on that. And again, we are ignoring anything that's average, which is good. We're going to keep it moving so you get the point. Same thing, we would possibly talk to them about cruciferous vegetables and then caffeine. That's really just kind of something you can share with them in terms of how quickly they metabolize caffeine from any source, tea, coffee, cola. Next section is methylation. So we take the same approach. We look at anything that's high. We read over here why that's important, and we can share that with the patient. The action steps will be really mostly about food and supplementing, and we have a lot of things here. So we're going to highlight. So if we ever refer back to this, or our patients want to refer back to it, they see we've highlighted it out of importance. Now I'm going to pause here and just let you know we're going through this very fast, and I'm doing this on purpose. And I want you to know that all these nutrients that are being indicated here are going to be down below in the grocery list. So I'm just going to run down there really quick. Every test has this. And so you see that although we're flying through the top, it's right here again. So all those nutrients that we were just looking at, they're right here. They're on the grocery list. They're highlighted, and the foods that are richest sources are right here. So these are, for you as a practitioner, things to choose. Can you get patients eating this way, and or do you need to have them supplement? So back up to methylation, we're just moving through the test, just like you would do any other section. High priority, and you certainly can spend a moment reading. I would read every box that's high. I would read every box. I would take note and see if there's anything you can share with the patient regarding that. And I'm going to show you how we do that in a minute. Same with hormone support. Again, now we're going to focus in on high priority. We're going to share with them anything that we feel is pertinent from this box. We're going to talk about glutathione maybe, and we're going to talk about boosting glutathione with nutrients and foods. Keep it moving. Mental health and cognitive performance. Now, again, you can always spend a minute here when it's medium priority and take a look and see if this fits into your patient's profile, something they're dealing with right now. Maybe they were an athlete and they did a lot of sports that led to concussions, and you really want to take a look at this and you want to read this to them and review it yourself so you have a good sense of what's going on here. Again, we're going to be skipping anything average, and now again we have high priority. So we're going to take note, we're going to highlight it, We're going to keep moving. We're going to read the box because it's high priority. I'm going to make sure we know what we're talking about here. In this case, mood and genotype that determine folate requirements for healthy BH4 levels responsible for neurotransmitter balance. Now we're going to support that patient. Same thing with the anxiety and the choline. Next thing we see is REM sleep. This will be very important to communicate to the patient. We're going to ask them to, how do you sleep? How well are you doing with sleep? And see if they can focus on it a little bit. Stress management is next. And we would treat this the same way any of the other groups. Any high priority, if there were any, we would focus in on, we'd read the box and possibly share that information with the patient. Again, if it was appropriate to their DNA and or how they're feeling physically. So this was only a medium priority here, but this person, has a lot of stress and they like going to the gym. You might want to talk to them about adding some weight training into their fitness routine, and they might find it really works for chronic stress. So it's a way to use this test to take a snapshot of how they're doing right now and then support them in this manner. Next is detoxification. Now, detoxification comes to a lot of things for a lot of people. So we look at the high priorities, we highlight them, we review them. We don't get too caught up with it because, again, the food is down in our grocery list, but we just make aware of it. And then sometimes there are situations like occupational toxins. If this person does work in industry where they're exposed to these kind of things, we can ask them to read this box, try to do the best, like, wearing protective clothing, and then also doing this nutrition and doing these foods because of their high priority to toxins, especially with these specific ones here. And every box you would treat the exact same way. So same thing, you see your high priorities, read the box, see if that matches up at all with what your patient's dealing with, and appropriately communicate this information, and so on and so forth for the rest of the test. And you can see it just continues on. So we kind of approach it the exact same way. We get into every section. We look at high priority. Here we have one in immunity. We're going to highlight that. We're going to read that so we know what it is. And then we're going to look at the support. Now, again, we don't have to write down C and D and selenium, magnesium, but we know that these are helpful strategies. And a lot of this nutrition is down in the grocery list. Now, this one is interesting because it's lung severity if this person does get COVID. So if this person does have COVID positivity, they definitely want to be increasing these nutrients, specifically here, because of their risk with lung damage regarding COVID and how it affects their DNA in their system. And you can always, again, I always stop at any of the highs. I read the box, see if there's any pertinent information I can share, with that patient, and so on and so forth. So we're not going through this whole patient's test just because I want you to, I want to continue through quickly for you and just see how easy it is to get through this and focus on what is most important. And again, you'd be doing this, you'd be doing this, you'd be reading those boxes and sharing that information as high priority. You see, a lot of things are not high priority and a lot of things are not medium. So we're saving time, right? We're not going to spend any time here. We're just going to get over here. So I'm going to take you down to the end and remind you anything that's high priority, you're going to continue to highlight, you're going to continue to share with the patient. Sorry, right here. And then I want to show you one thing we do at the end. So exercise, and then our genes, and what is associated with why our outcomes are this way. Then we get into our foods that we talked about earlier, our personalized DNA grocery list, which you definitely want to share with them. If they don't want the whole test, or you want to just print out a couple pages or email them, these 2 pages would be the most important. The DNA-based grocery list. 3 pages. And then next, we have personalized blood work. So this is one thing just to note. We're not telling you, the test is not telling the patient that this person has any issues out of range. What it's telling you is if one, they are sick, these are things to get tested, and or have any history of issues, get tested, or if they're going for a routine blood check and want to be careful and preventative toward their DNA, they can have any of this tested. These are things that people with their genotype typically may or may not have out of range. But again, this test is not telling us the LDLs, the triglycerides, the D is out of range. It's just saying, based on their genotype, these are things they need to watch. And that's that. So the other thing I'd like to share with you is once that is done, you've gone through that test quickly and focused really just on those high priority issues. We have something here where you can request from any of us at Reveal My DNA. And it's just a template of a nutrition and lifestyle plan. So what is this? This is the information taken from the test that is high priority. So remember this person, now this is a different patient. And this person had an E3, E4. I say, please read this entire section. This is taken from the right-hand box of that APOE status. If there are 4 on either E3 or excuse me, E4, E3, E3, E4, I put this entire section in this box so they can read it. And again, I highlight, it does not mean a person will develop the disease. So we're not here to scare people. We are here to help them, support them with many things that can mitigate the risk of Alzheimer's disease, and most importantly, the symptoms of Alzheimer's disease. So we have a lot of strategies here for them to start. Then the dietary recommendations from that macro section we looked at: increased protein, the carbohydrate consumption, the dairy, so on and so forth. The vitamins that came up as high priority, the minerals that came up as high priority. Then their phytonutrient requirement that we talked about. Remember the phytoestrogens and cruciferous vegetables. This person needed cinnamon and this person needed resveratrol. They're all different, so you can use this template. You can add and delete as needed once you have this base. And I'll give you a secret. Easy way to use Microsoft Word is use this dictation button. Hello. It will add it to your reports wherever you are. You can read it off their report and dictate right into this report very quickly. So I have each section here, phytonutrients, so you don't have to retype each section out. We have them here: methylation, hormone support, mental health and cognitive performance. If there's anything particular you want to focus in on and make sure they remember, like avoid those concussions, getting out of sleep, you can just highlight yourself right here. Using the functions of Microsoft Word. Sleep recommendations, stress management, detoxification, down to immune support, and then their DNA protection section, so on and so forth. The blood work awareness. Now this, of course, won't have the grocery list in it. You already have that separately done. And then here, if you want to put in some products, and then also notes. So what do we want this person to do? They were high priority for food dyes. So in the special instructions, absolutely avoid food dyes. That includes certain brand names, other colored sports drinks, and certain brand name foods. You can take those out if you want, certainly, but this is just an illustration. Anything with artificial colors. So I hope that was helpful for you. I think that it's a quick way to look at this test without getting overwhelmed by the larger results. A couple things to keep in mind. This test is valid forever. So after that patient takes the test, you take the test, those results will always be good. They'll always be meaningful for you. You can always go deeper and look into the medium priority sections as well, especially if it's something around the health of that person. So let's say they didn't really have any high priority under heart health, but they're getting older. they're not taking care of themselves the way they should. They're not exercising and eating right. Go into the medium priority and see where the biggest risk factors are in cardiovascular for them might be. It could be blood pressure, it could be triglycerides, who knows what. Everybody's different, so we're going to get different things. So that will wrap up our 15-minute review of the test. And if you want a more in-depth review of each and every section, please go back into our archives. We have lots of recorded videos and get you through each section in a deeper, more meaningful way. Thank you very much.